All right, let's talk about something called digital health. What is it? It sounds a bit like your computer needs a doctor, right? But no, it's simpler than that. Think of it like technology meeting healthcare. Your phone, your tablet, the internet, all these things are now helping people stay healthy. It's about using these cool digital tools to make getting medical help easier, faster, and sometimes even cheaper. This isn't just for fancy hospitals in big cities. The goal is to bring better health to everyone, everywhere. It's a pretty smart idea, if you ask me. So why is digital health suddenly such a big deal, especially in a place like Africa? Well, imagine this. Sometimes the nearest doctor or clinic is very, very far away, or perhaps the queues are incredibly long and you spend a whole day just waiting. Technology can offer a way around some of these problems. It's like finding a secret shortcut on a very busy road. Instead of a long journey to get advice, maybe that advice can come to you right on your phone. It's about making things more convenient and accessible for ordinary people. This whole digital health movement is not just a passing trend like some weird fashion statement. No, this is a real revolution. It might be a quiet one happening on phone screens and through internet connections, but it's powerful. It's fundamentally changing how people think about their health and how they get care. From the bustling markets of Lagos to the quiet villages in rural Kenya, these digital tools are slowly but surely making a difference. It's quite an amazing transformation to witness, unfolding right before our eyes, one app at a time. So, in this little chat, we're going to dive into this. We'll explore how Africa is embracing these digital tools for healthcare. We'll look at the amazing innovations popping up all over the continent. We'll also talk about the tricky bits, the challenges that still need to be figured out. And finally, we'll think about what all this means for the future, especially for the next generation. So get comfortable, maybe grab a cup of tea, because this is a story worth hearing. It's a story of hope and ingenuity. Now, before we get too excited about all the new tech, let's take a quick look back. Let's talk about the before picture of healthcare in many parts of Africa. For a long, long time, the situation has been tough. That's just being honest. Access to doctors and nurses hasn't always been easy for everyone. In many communities, there simply aren't enough trained medical professionals to go around. This shortage puts a huge strain on the healthcare workers who are there doing their best under difficult circumstances. They are often overworked and under-resourced, which is a massive challenge. Think about it from a personal perspective. If you or someone in your family gets sick, you want help quickly. You want to know what's wrong and how to fix it. But what happens if the nearest clinic is a full day's walk away? Or if getting there requires expensive transport that you can't afford? This is a reality that many people across the continent have faced for generations. It's a situation that creates anxiety and can, unfortunately, lead to worse health outcomes if care is delayed for too long. This is a serious issue. Resources have also been a significant constraint. It's not just about having enough doctors, it's also about having the right medicines, the necessary equipment, and reliable facilities. Sometimes even when you reach a clinic, they might not have what you need. This isn't due to a lack of effort from the healthcare staff. They're often heroes, working miracles with very limited supplies. They stretch every resource as far as it can possibly go. But there's only so much you can do when the basics are scarce. It's a constant struggle. So this was, and in some places still is, the general scene. A healthcare landscape filled with dedicated, hard-working people, but also a landscape marked by significant obstacles, distance, cost, and shortages. It's against this backdrop that the idea of digital health started to shine so brightly. New technologies offered a glimmer of hope. A potential way to overcome some of these age-old barriers. They presented an opportunity to reimagine what healthcare delivery could look like, making it more accessible and efficient. This context is key to understanding the revolution. Then something incredible happened. The mobile phone arrived. At first, these phones were pretty basic, weren't they? You could make calls, send a text message, maybe play that addictive Snake game. Remember Snake? Hours wasted, good times. But then, these phones started getting smarter and smarter. Suddenly, they weren't just phones anymore. They were powerful little computers that people could carry around in their pockets or handbags. This was a monumental shift, especially in Africa, where mobile phone adoption exploded. Suddenly, a huge number of people across the continent had access to this transformative technology. Internet connectivity also began to spread, slowly at first, but then picking up pace. What was amazing was that even in areas where building a new road or laying a landline was incredibly difficult and expensive, a mobile phone signal could often reach. This meant that information, which is so crucial for health, could now travel at the speed of light, or at least at the speed of a 3G connection. This was a true game changer for communication. This widespread access to mobile technology was huge for many reasons. It wasn't just about staying in touch with family and friends. It meant that vital health advice could be disseminated quickly and widely. Reminders for medication, information about vaccination campaigns, or warnings about disease outbreaks could now reach people directly on their devices. It allowed for new ways to connect patients with health workers, breaking down the barrier of distance. The phone became a bridge, linking people to information and services they previously couldn't access easily. So the smartphone and even the simpler feature phones became much more than just communication devices. They evolved into tools for education. They became platforms for mobile banking, transforming financial inclusion, and very importantly, they became the primary gateway to a world of digital health services. This massive mobile penetration laid the essential groundwork. It created the infrastructure upon which the digital health revolution in Africa could be built. Without the phone, much of what we're seeing today wouldn't be possible. It was the key that unlocked the door. So with all these smartphones spreading across the continent, it was only a matter of time before clever people started creating apps for them. And of course, health apps were high on the list. This whole area is often called M-Health, which sounds a bit like a superhero name, Captain M-Health. But really, it just means mobile health. It's all about getting health support information and services directly through your mobile device. There are so many different kinds of these apps now, each trying to solve a specific health problem, which is fantastic. Some of these M-Health apps are designed to provide crucial health information directly to users. Imagine you're a new parent and your baby has a fever in the middle of the night. An app could offer immediate, reliable advice on what to do or when to seek urgent medical attention. Other apps focus on preventive care, like sending reminders to take your medication consistently. This is incredibly important for managing chronic conditions like HIV, tuberculosis or diabetes, where adherence to treatment is absolutely critical for good outcomes. These little reminders can make a huge difference. Then there are apps that go a step further, actively connecting people to healthcare workers. You might be able to ask a nurse a question via text message or even have a short consultation. This can save a long and expensive trip to a clinic for a minor issue. For instance, initiatives like Mom Connect in South Africa have been incredibly successful. This service uses mobile messages to provide pregnant women and new mothers with stage-specific information and advice, improving maternal and child health. It's like having a supportive health companion right in your pocket. And let's be clear, these mobile health applications are not just fancy gadgets for tech enthusiasts. They're genuinely saving lives and improving the quality of life for millions. They're making healthcare more accessible, especially for people living in remote or underserved areas where traditional health services are scarce. It's a practical, smart, and increasingly widespread approach to tackling some of Africa's most pressing health challenges. The innovation in this space is truly inspiring, showing how technology can be harnessed for the greater good, one download at a time. Section 5. Doctors on Demand Telemedicine takes hold. Okay, so mobile apps are brilliant for information and reminders, but what happens when you feel you really need to see a doctor or a specialist, but they are many, many miles away? Or perhaps the local clinic is overwhelmed? This is where another exciting digital health innovation comes into play, telemedicine. You've probably heard of it. Essentially, it's like having a doctor's consultation over a video call or sometimes even just a phone call. It's healthcare delivered remotely using telecommunications technology. It's pretty cool. With telemedicine, you can describe your symptoms to a doctor or a nurse who might be in a completely different city or even a different country. They can see you if it's a video call, ask you detailed questions and assess your condition. Often this virtual consultation is sufficient to provide a diagnosis for common ailments, offer medical advice, or even issue an electronic prescription that you can then take to a local pharmacy. All of this can happen without you needing to leave your home or your local community, saving time and money. This technology is an absolute lifeline for people living in remote rural areas where access to specialist medical care is often severely limited. It's also incredibly beneficial for individuals who have mobility issues or chronic conditions that make traveling difficult. Furthermore, telemedicine can support healthcare workers in local clinics. A nurse or a general practitioner in a small clinic can use telemedicine to consult with a specialist in a larger hospital, getting expert advice on complex cases. This helps to upskill local providers and improve the quality of care available locally. Across Africa, pioneering companies and health services are making this a reality. For example, services like those offered by Babylon Health in Rwanda or various platforms emerging in countries like Kenya, Nigeria and South Africa are demonstrating the immense value of telemedicine. They are proving that geographical distance no longer has to be an insurmountable barrier to accessing quality medical advice and care. It's like the doctor's traditional waiting room just got a massive continent-wide virtual extension open to many more people. Section 6. Data is king or queen. Analytics for better health. Now all these digital health tools, the apps, the telemedicine platforms, the electronic records, they generate a massive amount of data, health data. And this data, if it's collected, managed and analyzed properly, is incredibly valuable. It's like gold dust for public health. We're talking about the field of health analytics. It might sound a bit complicated, like something for scientists in white coats, but the basic idea is simple. It's about using data to find patterns, gain insights, and make smarter decisions about health. Imagine being able to see, almost in real time, where a particular disease, like malaria or cholera, is starting to spread. By collecting and analyzing data from clinics, mobile health apps, and even environmental sensors, health officials can spot outbreaks much earlier than before. This means they can react faster, dispatching medical teams, supplies, and public health warnings to the affected areas more efficiently. This rapid response capability can save countless lives and prevent small outbreaks from turning into major epidemics. It's proactive, not just reactive healthcare. This data also helps health planners understand the biggest health challenges in specific regions or communities. Are certain areas seeing higher rates of maternal mortality? Is diabetes becoming more prevalent in urban centers? By analyzing this information, governments and health organizations can allocate their limited resources more effectively. They can tailor public health campaigns and interventions to address the most pressing local needs. This leads to more targeted and impactful health programs, ensuring that money and effort are spent where they will do the most good. Of course, with all this data comes a big responsibility. Protecting patient privacy and ensuring data security are absolutely paramount. There need to be strong regulations and ethical guidelines in place. But when handled responsibly and ethically, this health information becomes a powerful tool for building stronger, more resilient health systems. It's like having a detailed map and a compass, guiding public health efforts towards the areas where they can achieve the greatest positive impact on people's well-being. This is truly transformative for planning. Section 7, the hurdles. It's not all smooth sailing. Now, listening to all this, you might think digital health is the magic solution to everything. And while it's incredibly promising, we have to be realistic. It's not like you just download an app and all healthcare problems disappear. Poof! No, there are definite challenges, some of them quite significant. It's important to acknowledge these hurdles because overcoming them is key to unlocking the full potential of this revolution. It's a journey with bumps in the road, not a perfectly smooth highway. We need to be honest about the obstacles. First and foremost, there's the issue of infrastructure. For many of these digital health solutions, especially things like high-quality telemedicine video calls or large data transfers, you need reliable and fast internet access. You also need consistent electricity to power devices and keep servers running. Unfortunately, in many parts of Africa, particularly in rural and remote areas, this basic infrastructure is still lacking or is very unreliable. This digital divide can mean that the communities who need these innovations the most are the hardest to reach. Then there's the question of money, funding, developing sophisticated health apps, setting up telemedicine platforms, purchasing the necessary hardware, and training healthcare professionals all require significant investment. African governments often have many competing priorities and limited budgets. While international donors and private investors are playing a role, securing sustainable long-term funding for digital health initiatives remains a major challenge. It needs to be seen as a critical investment in the future, not just an expense line item on a budget sheet. And finally, there's the human element: training and digital literacy. It's not enough to just introduce new technology. Doctors, nurses, community health workers, and patients all need to be trained on how to use these digital tools effectively and safely. Building digital literacy across the population is crucial. People need to feel comfortable and confident using these services. Overcoming skepticism and ensuring that technology is user-friendly and culturally appropriate are also important considerations that require careful thought and planning for successful adoption. Section 8, the upside. So much potential, it's exciting. Despite all those hurdles we just talked about, the flip side is that the opportunities presented by digital health in Africa are absolutely massive. We're talking truly enormous potential here. It's the kind of potential that gets you really excited and optimistic about the future. When you look at what could be achieved, it's hard not to feel a sense of hope. This technology offers a pathway to dramatically transform healthcare for the better, reaching more people more effectively than ever before. The possibilities are genuinely inspiring. Just think about the direct impact on health outcomes. We could see significant reductions in preventable deaths, especially among mothers and young children. Chronic diseases like diabetes and hypertension, which are on the rise, can be managed much more effectively with continuous monitoring and support through digital tools. Early detection of diseases through better data and accessible diagnostics can lead to more successful treatments. This isn't just about abstract numbers. It's about real people living longer, healthier, and more fulfilling lives across the entire continent. And it's not just about health. There are significant economic benefits too. A healthier population is, quite simply, a more productive population. When people are healthy, they can work, they can learn, and they can contribute more fully to their communities and their national economies. Beyond that, the burgeoning digital health sector itself is creating new jobs. There's a growing demand for software developers, data analysts, technical support staff, and trainers. This fosters local innovation and contributes to economic growth in a new and exciting industry. Furthermore, embracing digital health can lead to the development of much stronger and more resilient overall health systems. These systems can become more efficient, reducing waste and making better use of scarce resources. They can become more responsive to the needs of the population and better equipped to handle public health emergencies like pandemics, as we've seen recently. The integration of digital tools can create a healthcare infrastructure that is fit for the 21st century, capable of adapting and evolving. The upside is truly phenomenal for Africa's development. Section 9, the future is bright and digital, shaping generations. So when we put all of this together, the innovations, the challenges, and the immense opportunities, what does it really mean for the future? Particularly, what does it mean for the children who are growing up in Africa today, the next generation? Well, it means they have the chance to experience a healthcare landscape that is vastly different and significantly better than the one their parents or grandparents knew. They are being born into an era where technology is making quality healthcare more of a tangible reality for everyone. Imagine a future where every child, no matter where they are born on the continent, has access to timely and accurate health information. Picture a world where your geographical location, whether you're in a bustling capital city or a distant rural village, no longer dictates the quality of medical care you receive. Envision a healthcare system where technology empowers doctors, nurses, and community health workers to perform their life-saving work even more effectively. This digital health revolution is actively building that future, brick by digital brick, right now. This movement is about much more than just fixing the problems of the past or catching up with other parts of the world. For Africa, this is a unique opportunity to leapfrog. It's a chance to skip outdated models and harness the very latest digital technologies to create healthcare solutions that are truly innovative, context-specific, and world-leading. Many African innovators are already showing the way, developing solutions tailored to local needs. There's a real chance for the continent to become a global hub for digital health innovation. Ultimately, the digital health revolution sweeping across Africa is about more than just sophisticated technology and clever apps. It's about instilling hope. It's about empowering individuals and communities to take greater control of their health and well-being. It's about laying the foundation for future generations to have a healthier start in life, with more opportunities and a brighter tomorrow. And that, as we often say, is a story that's not just important, it's transformative. It's progress you can truly believe in, and it's happening now.